right, here we go. My name is Danny Sawai. I'm the owner of Evolution Fitness here in Tucson, Arizona. And I want to talk a little bit today briefly about hamstring injuries. I have a good number of people that will come to me for my corrective exercise saying they continually pull their hamstrings. And a lot of times they think they have tight hamstrings, they need to stretch their hamstrings. And one of the things that I notice about this is the hamstrings are tight, but it's not because they're short and they need to be stretched. Actually, a lot of times they're in a state of being overstretched. So what I mean by this is our hamstrings actually attach right here at the base of our butt, kind of that bony thing right here. It's called the ischial tuberosity. And then they attach again in our lower leg or calf area, in our tibia and fibia, those areas down here. And what happens a lot of times, people will be walking around that I see are prone for hamstring injury, is they're like this. So what's going on is their hamstrings, they have really tight hip flexors. So sometimes the rectus femoris or psoas muscles and some of the other TFL and other muscles here that actually when they're tight or when they are shortened in a contracted state, they're actually pulling down on the hips. When this happens, the hamstring, this bone that the hamstring attaches on at the hip, is actually being pulled forward and up. And so the hamstring is now overstretched. So to tell people to stretch your hamstrings more is kind of irresponsible a lot of times, and it'll actually cause them into further imbalance or further stretching of the muscle. It's kind of like a guitar string. If you keep cranking it and stretching it, eventually you strum it too hard or you crank it too hard and it'll snap or pull. And so that's what happens with this. So there's a test, a really quick test. It's called the Thomas test. And we just check for basic hip flexor and at the hip joint tightness or shortness or overactivity in the hip. One of the basic things you can do before you can do that is look at their stance. If they're standing like this and their butt is back, we know that they might be at risk. So I'm going to have Jackie just scoot down towards the end of the table here. And yeah, there you go. And then I'm going to have you rock back with both, good, and then rock both feet back for me. Then interlock your fingers around this leg, okay? And just, and there you go. And then if someone is really tight, a lot of times they have kind of things, you'll see something like this, where now their leg and their knee is way high over, and that means these muscles are really tight. So Jackie, now relax down into the correct shape. A lot of times I'm looking for something more like this. So this is more what I'm looking for in this area. So when it's really high like this, I know that there's probably something going on in the upper rectus or psoas muscles or TFL or some of the muscles up here in the hip. Another thing I look for in this test as well, and Jackie actually has this going on, switch legs, is this side when she's relaxed. See how this is now out? So her leg isn't so far that it's jacked up and high, but it's really, her knee is not relaxed here. It's not, that's a stretch for her. And that's showing her quadriceps are very, very tight through here, and sometimes it does transfer over in the hips. So there's a lot of different things we can do in terms of stretching that I'll show you in future videos. There's actually a video on the chair. The chair stretch video is a great stretch to get in the quadricep and rectus. But what we're eventually doing is as we stretch this, we now open up the hips, and now we can change the way the hips are situated a lot of times, and there's a lot of different techniques to do that. So the take-home message, if you have someone that constantly has tight feeling hamstrings or hamstrings that continually pull, it's really important that you look at the front side of how we can stretch and elongate this compared to just focusing on the problem that hurts or continues to pull.